Yeah,
Yes.
I just wanted to clarify. I was a last-minute entry into this thing.
Yeah.
Pramod couldn't
Most of the
make
speakers are the last minute.
Pramod couldn't make it. And just a small correction, I'm not Muralidhar Ramappa, but I'm ST Muralidhar. That's the change that is there. Yeah. Okay. So, very good morning and thank you for this opportunity. The topic is counseling of patients by residents. For a minute I was wondering whether fresh residents or residents who have completed their post-graduation. I believe it's post-graduations and somebody who's in the third year of the residency who would be actually involved. So I would speak in favor of it. And if we go back and figure out what makes a good doctor, there was a Twitter survey in 2019 where they showed that empathy, although is the most important one, but competence stands fifth. Now, so you need these soft skills to explain to the patient about what is his problem, and you describe the details, the natural course, etc. So the purpose of all this is to establish a doctor-patient relationship. And so now, in this regard, we were actually trying to compare who should counsel, residents versus counselors who have actually been trained to counsel. So what we realized on a scale of 10, that the disease description is better by the residents than the counselors. The current status of the disease is better explained by the residents than the counselors. And you have the whole host of things. What we realized was costing and scheduling of whatever is the procedures or the treatment processes, the counselors are much better positioned to do it. Whereas most of the other descriptive elements are better put forth by residents. So on a scale of 10, we realized that 8 out of 10 parameters are better suited for the residents, and about 2 parameters, the counselors are better off. And why we need this? See, in the era where we have so much of violence against doctors and all those things, we had poor communication skills of the healthcare people as one of the major reasons. And so, if you have an effective counseling, you can increase the treatment adherence, you can reduce the malpractice claims, you can have fewer tests and second opinions, and you can actually prevent misunderstanding, conflicts, etc. So, clear pointers or technical details are better suited for the residents. In turn, the residents over time gather more confident attitudes and gain valuable inputs from when they speak about the disease to the patient. Non-physicians are better communicators regarding costs and further scheduling of whatever is the processes. So how can we combat this? Well, we have only one thing, that we try and incorporate patient counseling in the schedule of teaching so that they can be groomed as they come into the market. Now, I acknowledge some of the inputs were by Dr. Alankrita Muralidhar, who's doing a DNB fellow here at the Shroff Charity Eye Center. And so now I would eagerly wait to hear why not from my next speaker. Thank you.
Thank you very